In this tutorial, we're going to be talking about how to rehab plantar fasciitis. So we're going to talk about a few things before we get into that. So we'll talk about what it is, because there are some misconceptions in the public as to what it is, and it can get misdiagnosed in that regard. Then we'll look at tissues involved. Then we'll look at the rehab process and the sort of process that I would use with regards to using sports massage and the necessary homework that someone would be doing. First of all, what is it? As you can see up here, self-limiting fibrofatty degeneration of the plantar fascia origin. That's an important part of what we're going to talk about. And then with micro tears in the fascia and collagen necrosis, which is essentially the degeneration and death of certain cells. Now, when we're talking about the plantar fascia, it basically goes from the heel bone here up into each, let's just say, knuckle, and then you've got a sort of sixth branch which goes along the lateral aspect of the foot. But when we're talking about plantar fasciitis, generally the pain is felt up here, and then as it says here, you have got micro tears in the fascia, so there may be some degree of pain up here, but mainly for plantar fasciitis it needs to be pain in the at the origin of the foot, or of the plantar fascia. So if we get someone who's just coming with pain in here, yes, there may be some micro tears in the plantar fascia, but generally you may find that there is not tightness in the muscles at the bottom of the foot. Now, this, if someone has plantar fasciitis, which is pain up in here, sort of the medial aspect of the origin, they may well have pain in here as well. So it's sort of, you kind of got to treat the whole system. How is this happening? It can be due to a high arch, shortened due to a high arch. So you've got the plantar fascia, which goes from the heel bone up to the knuckles. Now, obviously, that will become shortened, and that encourages the arch to become raised. You've then got overpronation of the foot, which is essentially where the arch can collapse. So at two ends of the spectrum, we can have problems here. Tight Achilles, so tight Achilles tendon, and then sudden increase in activity. So all of these are going to be putting stress on the plantar fascia, which is then going to cause the degeneration over time. This will be something that happens over time. And then the increase in activity will be the straw that broke the camel's back. But you may be able to notice this in tight gastrocnemius, tight soleus, tightness through the Achilles tendon. So that could be some precursors to it. And then what's happening? Plantar heel pain, which is, as I mentioned, it's the pain that's coming from here rather than pain that's coming from here. They may have pain alongside that, but essentially pain is here, and then this would be secondary. So we have to make sure that they have the pain here to be able to call it plantar fasciitis. The tissues that are involved, I've kind of mentioned most of them already, or all of them already. We've got the plantar fascia, which again originates on the heel bone and then goes out to each toe, sort of up towards the knuckle of each toe. And then finally, there is a branch that goes along the outside of the foot as well. We've then got the Achilles tendon, which again joins on to the calcaneus. And what we do have as well is, if you look at anything written by Thomas Myers, where he talks about the anatomy trains or the fascial lines, he will describe that there is a fascial connection between the plantar fascia here, which then essentially goes up and around the heel bone into the Achilles tendon. So that is why tightness up here, tightness down through the Achilles tendon can then have an effect on the plantar fascia, which is down here. We've then got the muscles of the foot that you can see on this diagram here. So when I talk about pain in the midfoot, generally it will be from muscles here. So these are or you will need to sort of massage through it, stretch through it, and then eventually activate these muscles to, in some respects, retrain them, reset them. And then you've got, as I've mentioned, muscles of the lower leg. So we've got let's just say the main culprits, which will be gastrocnemius here, and then soleus, which is below it. But there may well be tightness, just as a residual tightness, through the muscles of the front of the leg as well. So we have to, in some respects, not only look at the plantar fascia, but then work our way out from the, let's just say, the joint below, which would be the toes, and then the joints above, which would be the muscles of the ankle and potentially muscles of the knee as well. When it comes to rehab, what you can see on the screen here is we are basically talking about massage, rolling, stretching. So massage would be if they were coming to see me with regards to sports massage, so that's what I would be doing with them. When it comes to rolling, I would then be suggesting rolling exercises that they could be doing at home. And then stretching, again, they would be doing that with me in the gym or in the treatment room. And also I would be suggesting them doing that at home. How I would normally do it is I would basically be booking them in for a minimum of 2 sessions, and I'll sort of explain why as I work through these bullet points, and in some respects that will help you understand the process that I use with regards to how I work. So with regards to rehab, we've got plantar, massage and stretchings. Now obviously the plantar, that means part of the foot, so the lower part of the foot, the underneath of the foot. So this is what I would be massaging and then stretching. Now obviously I would be starting with consultation and assessment to establish, do they have pain on this sort of medial part of the plantar fascia? That will then help me understand if it's plantar fasciitis, or do they just have tightness through the foot, which would then give me, again, I wouldn't need to be focusing so much on this area, but more focusing through this whole area. So first of all, it's establishing that. Then it's a treatment working on this initial area. So what I won't do is I won't rush through to try and cover all of these bases in the first hour. That's why I've got the second session. So I would work on the injured area, I would work on the foot, and I would aim to work on the Achilles. So that would be my initial aim for the first 60-minute session. After that, if I just add in that one as well, after that I would then start working away from there. Now if I had the time, I would go into this. But I would start working away from there, and then I would move into this for the second session. So essentially what I'm doing is I'm massaging the plantar fascia and the muscles of the foot, which again are on the plantar part of the foot, which is the underneath part of the foot. I would then start working up into the Achilles tendon, around the ankle joint, so possibly looking at things like the spring ligament and the deltoid ligament. You've got obviously the Achilles tendon. You've got other the ATFL, the CFL, and the PTFL as well around the ankle. Just trying to loosen off essentially the whole system. So looking at the under part of the foot, possibly looking at the range of movement of the toes as well, working on those muscles as I've described. And then once we've got that, give them their homework. So show them the stretches that they need to be doing, or that you need to be doing. And then getting them back in a week to 2 weeks' time, and essentially gaining feedback from them, pain levels or pain intensity, pain duration, pain frequency, and are we moving in the right direction? If we are moving in the right direction and all that is starting to reduce, I can then start to branch out into muscles of the lower leg. So I would be massaging and stretching those. So the main muscles that I would be looking at first would be gastroc and soleus. Reason for that is obviously we've mentioned the plantar fascia and up into the Achilles. Now if you read anything by Tom Myers in Anatomy Trains, he talks about fascial lines, and the superficial back line basically starts at the plantar fascia. You then get fascial fibres go around the calcaneus, around the heel bone, up into the Achilles tendon, and then up into the leg, hamstrings, glutes, so on and so forth. So my main focus would be spend a little bit of time in the plantar fascia, the foot and the Achilles, so get that again, just refreshed, but then spend a little bit more time up into the soleus, up into the gastroc, and then get them on the front of the leg as well. So we're looking at anterior tibialis. I would also do a bit into posterior tibialis, but also the peroneal muscles as well down the side of the leg. Again, just loosening off that whole system, being able to relieve any stress on the whole area. Then, if necessary, I would go above the knee, hamstrings, glutes, so on and so forth. Depending on how the consultation went and the initial causes, we would then be looking at tissue retraining. So, is it a biomechanical issue? Is it their running style that's creating the injury, or is it just the fact that they increased the amount that they were doing? So it would just then be, if it's the biomechanics, helping them manage their biomechanics, or it's educating them on rest recovery ratios with regards to training, and in some respects intensity rest and recovery. So it might just be an increase in duration that they're doing. It could be an increase in intensity, could be an increase in both, so on and so forth. So it's helping them understand that to be able to manage all their different training. So I've tried to cover quite a few bases here, but that is the basic process that I would go through over a minimum of 2 sessions with someone who came to me with foot pain that could potentially be plantar fasciitis, or just fatigue, knots, stress under the foot. But that is essentially how I would work it, starting from the injured area and then essentially working down to the joint below and then up to the joint above as well, as far as the knee. And if they allowed me the time, I would then go into the hamstrings, possibly into the glutes, depending on the consultation, the assessment, and the feedback that's given, and their running style as well. So hopefully that's helpful. Hopefully it's giving you a better idea of how you can rehab your plantar fasciitis. So many thanks for watching. My name is Chris. I'll speak to you in the next tutorial.